Hello everyone. Today I want to show you another case that illustrates the power of doing gingival recontouring or crown lengthening procedures to add to the aesthetics of a case, not just to add to the functional aspect of the case, but to make it look beautiful. All right, last video we showed you how we could save teeth that normally would have been slated for extraction, and that the person would have been toothless in that area, or you could have used a removable prosthesis to replace the teeth, which, is okay, but that's 100-year-old dentistry. Most people don't really want that. Or you could have used dental implants to restore it, and that would have added a lot more treatment time, would have added more surgeries, and would have been much more invasive. So we could save those teeth with a lot less hassle and certainly much less surgeries in that for the case. But today I wanted to show you how it can add to the aesthetics of the case. Let me show the befores and afters. So here we have our teeth before, okay? These are pretty much all non-restored except for this tooth in the front, tooth number 9, okay? This tooth has an old porcelain fused to metal crown, and there was some gingival recession. I don't know if there was a cavity here that started all this, but there's a little patch here. This is a composite filling patching the area between the old crown and the gums here, okay? And so this has created a lot of gingival inflammation right here, and it's very unsightly. When the patient smiles, not only do you see this old crown sticking out, but you also see all this recession. And so what do we do here? If we're going to just replace the crown, even if we clear up the incisal edge here to make it level with the rest of the teeth, it's still going to look a lot longer, like twice as long as it should, because of this gingival recession that we're going to have to cover with the crown, and it just wouldn't look good. But, spoiler alert, here we are. My lovely partner did a beautiful job doing some gingival surgeries here. Beautiful job. This is very soon after the surgery was completed, and the gums here are a nice pink color, indicating that there's lack of inflammation and that there's nice health here. And it's almost healed completely at this point, soon after doing the surgery. But this result, we not only got a nice level incisal edge here, which is what we wanted to do, of course, but also the other half of the smile, which is where the gingiva is also nice and level, and it's been corrected. Now this patient also elected to do veneers on the bottom so that everything matched, and we got a beautiful result. Let's go through this case a little bit. Here I removed the crown and also the composite patch that was here. And this gives us a good view of the inflammation of the gingiva. See right here, this is a clear violation of what's called the biologic width that the tooth needs. So here, because of the bulk of the restoration, the patient wasn't able to clean very well. That added to the inflammation. And also the inflammation is caused because there's a lack of space between the restoration and the underlying bone, not allowing a proper seal to be formed there. And that chronic infection has caused this chronic inflammation right there. So this bleeds very easily. You just look at it wrong and it will bleed and be very unsightly. Okay. The other thing I want to point out is see how close we are to the nerve. A lot of tooth structure is missing here. And when you go laterally like that into the tooth, the nerve is very close. And so this tooth was actually dead. The technical term is necrotic. And so if I were to just put a crown on the tooth in this state, then high likelihood that this will become infected and sore later on. So what my partner did here is a preemptive root canal to make sure that that didn't happen. So we didn't have to drill through a brand new crown that matches everything else and just potentially crack it and everything. We do the root canals before the crowns. That's very important to do that. And so you combine the root canal, that's this tooth again, to make sure that there's no infection in the tooth, and then gum surgeries to make sure there's no infection in the gums. And then some nice restorations, a combination of veneers and crowns, and you can get a beautiful case. So here we have it finished. The before on the one side, and then the after over here. Leveled incisal edge, beautiful crowns and veneers that my lab did for us. And then this beautiful recontoured gingiva, which will have the patient being healthy for many years. So if you have any questions or comments about what you would like to see in the future, just let me know in the comments section and we'll make that happen for you. Thanks so much for watching.